Good morning. Drew Holley with BIS. This is America's most boring podcast. Today we're going to talk about types of small group plans. This conversation could go well beyond these three items I'm about to go over. HMO, point of service, PPO. Depending on your demographic, if you're listening to this, you may remember the old days, 1980s, early 90s of HMO. In the old days, these meant how many doctors can I go see, or am I limited? With HMO, generally speaking, being more limited, lower price, but I don't have as many doctors to go to. Point of service a little more broad, PPO even broader, but the pricier. In the old days, HMO would say you had to have a primary care doctor and you had to go see them first in order to be referred to a specialist. Those days are pretty much done in the state of Georgia with small group health insurance plans, okay? For the most part, what an HMO is essentially saying is, hey, here's a list of doctors you can see in network only, but you have no out-of-network benefits. So if you choose to go see a hospital or a doctor, which is generally not recommended from insurance advisors, you are making the choice that you're seeing someone out-of-network, but there's no contractual obligation of the insurance carrier to cover anything. You wouldn't want to do that anyways, so there are times when an HMO is in network only, but now HMOs have become more broad where they can cover doctors in network outside the state of Georgia. So point of service, the biggest difference now, not necessarily 10 years ago or 20 years ago, point of service covers in-network benefits and out-of-network, but the contractual obligation of the insurance carriers to actually cover you out-of-network, if you read the fine print, you're not going to be happy with your bill. It could be tens of thousands of dollars even if you have an out-of-network deductible. So generally speaking, point of service might give you more doctors or hospitals or surgery centers that you can see in network than your HMO, but that's not always true. Here in the state of Georgia, just depending on the carrier, United Healthcare, Aetna, or Blue Cross, or Cigna, we have seen where there are plenty of doctors in network here, and we can have upwards of 99% overlap. The only difference is this might cover out of network, but you may be thinking, I would never want to go out of network anyways. And so this is why you really got to have an advisor that knows the difference, because the price point could be 3, 4, 5%. And a lot of things in our economy, 3 to 5% is not a lot, but when it comes to healthcare, because it's so expensive, it is. And if you have multiple 30, 40, 50, 80 employees or more, this could be a big difference. Finally, PPO generally is going to be more broad. Now, the reason why it's more expensive is because generally speaking, to get doctors to accept that network, some doctors want to get paid more. And so that's why they're joining the PPO and they're willing to join it. And so some of those doctors, maybe in rural America, refuse to see a patient unless they are going to get paid a certain amount. And so the insurance carriers can't get that doctor in network without agreeing to pay them more. Therefore, they have to reshuffle the pricing to you as a small business, PPO, larger network. But for the most part, especially in a big city like Metro Atlanta, a lot of times the same doctors that you want to see or same hospitals or surgery centers can be equal in all three. But depending on your generation, you maybe think, I never want to do an HMO, but a lot of those days are over because of the primary care and just the way they've been restructured. So there's a lot more to this topic, but it's just a general idea for those that might be just curious, what's the difference in an HMO and a PPO? So if you have any further questions, feel free to reach out to us at bisbenefits.com. Thank you.